For this, because the femur bone is inside and covered by so many muscles around it, I'm not gonna choose that. I'm scared of it.
I don't know. I thought that this bone will be the strongest maybe. That's why I was not too afraid of this one. But that one, I used to play soccer a lot, and when you get hit in that bone, it hurts so much.
Gradually, I can bend my knee, and for now I can do a lot. At the beginning, I can only do this. When I do this, I will start to feel the pain from swelling.
I mean, I'm not trying to be the tallest. I'm just trying to have and feel comfortable with the height that I'm gonna have.
Hello everyone, today we are here with our patient. Today is a little bit different because we have two patients.
We have Fabrizio here and Wayne. Fabrizio did LON method from his femur. Wayne did LON method from his tibia bone.
Fabrizio, let's start with you. How was your lengthening process? You're still doing lengthening. How is the life with the fixator? Is it hard to move? I mean, can you do your daily routine with the fixator from femur area?
Yes, you can do pretty much everything. It's just, for example, when you go to sleep, obviously, you can only sleep facing up or facing down. You guys have shown us how to be able to sleep facing down. Sometimes when you have pin pain, it makes it a little bit more uncomfortable walking. Then I know that sometimes you guys suggest to pause on the lengthening, and that helps too because that gives the wounds and the legs a little bit of break and then to continue. But other than that, we can do pretty much everything.
Okay, how about the pain?
I feel a lot of pain, to be honest, but I think it's because I always thought that I was very strong, but because I'm very active, I snowboard, I play soccer, and I've had injuries before. So then I thought, okay, maybe when I go and do this process, I know the type of pain that I'm gonna go through. But what I did not think about is for how long. Because right now we're not basically healing. The healing process starts when we get this removed. But right now, we're just lengthening and separating the bone, and then that creates a little bit more pain with the tendons and the muscles. That is what makes it a little bit more painful than what I was expecting. The first day of the surgery, it was kind of similar to what I was expecting. Pain kind of continues because we're not healing yet.
How much centimeter right now?
Right now, I'm a little bit over 5 centimeters.
Why you choose femur?
Because I think that femur looks good. My legs were really short. Extending the femur will make it look a lot better. So that's why I chose femur, and because we can extend it a little bit more than tibia.
With the fixator, it's looking different. Maybe our followers will ask you also, can you do your daily routine like without any support?
Yes, I can walk with the walker or with the crutches.
We have a pin side, his body weight on the pin side. That's why you don't need to push the fixator, you know what I mean, until when we remove that. Also, we are doing training for upper body, for legs also. He's also doing well.
Oh yes, I come to the gym like almost every day when I wake up because I have pain on my legs and I want to get my blood circulating in my body. So that's why I try to come to the gym, and yeah, I can do it by myself.
Now, Wayne, I want to ask you. You did Tibia LON method and you're almost at the end of the process. How was your process?
At the beginning, I thought this would be a long journey. I feel it's almost the end, all of a sudden. Yeah, I come to here, for me it's like a rest. I just do sleep and exercise, do lengthening to go through every day. And that is kind of less pressure. At the beginning, the swelling is causing much pain for me. I don't like to stand because that is really pain. Most of the time I lie on the bed and do the stretch. Gradually, I can bend my knee, and for now I can do a lot. At the beginning, I can only do this. When I do this, I will start to feel the pain from swelling.
How much centimeters you reached now?
Now it's about 6.5, and my goal is 7, so maybe 1 week left. Then I can remove the fixator. And during this process, I don't feel really much pain, except swelling I talked about, and in the middle, I feel really good. I can walk anywhere. Sometimes the pain comes on and off. It's not always there for me.
Could you do your daily things while you have these fixators?
Other than put my feet together. This is my biggest hope right now. I want to put them together.
And what about your sleeping?
At the beginning, I have to wake up like 2 or 3 times in the middle, at night. And now I can sleep till no waking up in the middle. I sleep really pretty good, I think. Maybe 6 to 8 hours, sometimes 10 hours. Yeah.
You guys have same system, but in the different area. Do you want to ask question to each other? Because it's have different advantage and disadvantage.
For me, I think the tibia bone is more superficial. I will not be that afraid to this surgery. But for this, because the femur bone is inside and covered by so many muscles around it, I'm not going to choose that. I'm scared of it.
I don't know. I thought that this bone will be the strongest maybe, and that's why I was not too afraid of this one. But that one, I used to play soccer a lot, and when you get hit in that bone, it hurts so much. And it's the main support of your body when you're walking as well. So to me, I think that one's a lot more painful. I know that it's two bones, right? So what's happening with the other one? Because the strongest bone.
That was my question too, but that was amazing. He just have something connecting to two parts of the bone. Oh, because I have a bow leg, if I do femur, then my problem was not solved if I choose that.
You fix your problem, at the same time it's getting taller, right?
Yes.
You can use the ring lengthening to alter G with the fixator, but you cannot use because fixator on the outside, because you should use some shorts for alter G. It's really good for affect the ballerina foot. You can walk without any support inside the alter G.
But we have the problem of the Achilles tendon, right? They don't have.
Especially we are fighting with the hamstring muscles on the back line, the femur operation, and the tibia operation with Achilles tendon. It could be ballerina foot during lengthening, but after fixator removal, day by day it will be getting released, you know.
We don't have ballerina foot deformity right now. So can you tell our audience what you did for not having ballerina deformity?
Before I come, I do yoga. I'm just a beginner, but I can touch the floor without bending my knee.
Yeah, and your Achilles tendon was so flexible, I remember that.
And when I stay here, I stretch a lot. Are you going to have another surgery next time?
I'm good with this one. I mean, I'm not trying to be the tallest. I'm just trying to have and feel comfortable with the height that I'm gonna have. Be more proportional, because what I hated about my body was that I felt that my legs were really short. So obviously my wingspan was longer than my height. I'll see it every time, like on pictures with friends and stuff like that. I didn't like how my legs look all the time. That's definitely gonna help.
And also I can feel the table and the sink is getting lower and lower during the process. And I cannot reach
What's
my
your new
stuff.
height?
It would be like 183 or 184.
We choose 185.
The doctor doesn't let me do that.
His soft tissue is really good. I mean, in the tibia with 7 centimeter, he have almost 7 centimeter. It's really flexible. But why we recommend to remove at 7? Because about your bone healing. If your bone healing is good and your soft tissue is like it, we can keep it. But your health is important than every millimeter, every centimeter. That's why it will be much more healthy for you.
You forgot to say physio session.
It's the end of part, because I will ask what's your favorite device in physio room.
You mean there? I like massage.
Okay, that's all.
Not stretches?
Maybe it's hurting you.
A little bit hurt. At the beginning, maybe the first few weeks, first month, I feel pain every time you do stretching. And all I have to do is to take it and hold my breath. Now, start from the second month and the third month, I feel enjoy. I can enjoy that. But every time you do that, you seem like so tired, you know. Yeah. So I don't want you to be so tired. I can do that for myself.
Okay, can you imagine without physiotherapy, can you reach your goal?
I'm not sure, but with a therapist taking care of you is definitely better than no therapist. Yeah, and because they can understand your problem and they can give you confidence. Because they see so many patients before, you can have some reference. Otherwise, if you sometimes I feel pain, like in my ankle or on the wound, I can kind of lose the confidence. Am I going to stop? After a few days, you can feel, okay, that gone already. You can keep going again. Yeah, so confidence, I think, is the part.
And Fabrizio, what do you think about physical therapy sessions? Can you imagine without physical therapy?
No, I couldn't. I really feel that I need it. So sometimes flexibility, now that I've reached a little over 5 centimeters, I think just like him at the beginning, 2 months before coming here, I remember I started yoga because I was watching the videos and I knew that stretching was very necessary. I'm not a very flexible person. I started doing yoga. That helped me a lot because when I came at the beginning, everyone was telling me that I was very flexible, which in reality I'm not flexible, but the yoga really helped. But now that I'm over 5 centimeters, it's getting tougher. I feel that I can't stretch as much. Only when I have my physiotherapies. Well, you're my physio, so you push it a lot, and I like it. I mean, it's painful, but at the same time, it feels good. Yeah, I couldn't imagine going through this process without physiotherapy.
You are doing everyday lengthening. We are starting to lengthen 1 millimeter per day. You're changing your body anatomy every day 1 millimeter to tight, you know, it's getting tighter, tighter, tighter. Your blood circulation is getting different. Maybe that's why in nighttime is uncomfortable. Because if you stay a long time in same position, body give you some reaction, like, you know what I mean? Let's move, like, that's why maybe it's night is hard. Physiotherapy is helping for blood circulation, you know, like you said, in the beginning after surgery, body give you some reaction. For example, swelling. We are fighting with that. We have many devices. That's why physiotherapy is really important in the beginning, also during lengthening.
Fabrizio, what's your favorite device in physio?
Favorite device? I think it depends on the pain.
Everything.
Everything's very useful and important. I don't have a favorite one, but one of the ones that it's the scariest one is when you use that metal thing for the tendons. That one's super scary. But it helps. Like when you go through it, I just breathe deep in and and I let you do your thing, and it really helps. Like I feel that. Of course, I have a lot of pain after you push it, but then I feel like I have a little more blood circulation going through. So yeah, it's not one of my favorites, but it's one of the most effective ones.
And I think before I come, I know that a muscle can be lengthened, but I'm worried about nerve. I think nerve is not that flexible tissue, right?
Yes, less than muscles, but also you never had nerve pain.
Yeah, I'm surprised that I don't have that. I was so scared, like 4 centimeter, okay, it's not happened. 5 centimeter, not yet happened. I'm worried about when it's coming to me. Do you have nerve pain?
No, not yet. I hope I don't get it as well.
Okay, good luck.
But everybody is different about also nerve pain. You know, Michael, he did 15.3 centimeter, but he never had a nerve pain.
Actually, also listening to your physio is important, I think, because sometimes, yes, we want you to stop lengthening for a day or maybe 2 days. We want this for your good, for your health. And when patients stop for like maybe 2 days and their pain is relaxing a lot.
Yes, I at the beginning I didn't want to give myself a break. When I had a lot of pain, some nurses or you will suggest, but I didn't want to because I didn't want to stay longer. So I'll do maybe 2 times instead of 4. But now I try to listen more. So today's one of those days. You told me not to lengthen, so I'm not lengthening because I do have a little bit of pain. It feels better when you stop lengthening. It gives the muscles a break.
And then when you have pain, when we suggest you to stop, and after stop the lengthening, it's easier to move on, actually. Pain is relaxing, muscles are relaxing, so it's easier to move on. Sometimes stopping lengthening is also a good thing.
But then sometimes need to rest, you know, it's not like a machine, you know, you have to pin side, pin side is moving, you know. It's also actually it's about your bone healing. If you have less bone healing, sometimes we can decrease the lengthening speed. Sometimes if you have good bone healing, we can increase the lengthening speed too. It's about your, again, body condition. Guys, thank you for all answers.
You're welcome.
Welcome.
Görüşürüz, everyone.
See you guys.
Thank you for watching. See you in the next video.
Anything like goodbye, everyone.
You can, if you want.
Bye, Mom. Bye, Dad.
Can you do it?
Is this just? Oh, I can.
Of course you can.
Can you do it, bro?
I don't think so.
Can you say en büyük
En büyük
Beşiktaş?
Beşiktaş.
Thank you.
What is that? Thanks for watching.